talking about buccal fat. I think we're broadcasted and we're ready to roll. So I got my Topo Chico. We're going to start it out. And there's a couple things going on today. So I'm first going to start out with a pretty little intro video to kind of give you guys an idea of some things I was thinking about this week. The buccal fat pad, I talk a lot about it. I do a lot of it. And I really think it's a good treatment for patients to get that sculpted jawline, to give the essence or the appearance of a peaked cheekbone. We had some technical difficulties earlier, so that's why I'm chuckling. I was yelling at Dane, the videographer. I think first we'll roll into this video, or very shortly, this video about why I think buccal fat pad sculpting is needed. Then I'm going to talk to, hopefully have a special guest. We're not quite sure if that's going to be executed properly or not yet. But then we're going to have a special guest on to kind of give some ideas of how buccal fat pad accomplishes similar things to makeup and makeup artists contouring of the face and cheek. And then we got a little video about how I do buccal fat pad uniquely. We called it Chicago. It's because I sculpt and tighten the whole 4 layers of the face. And I think that's key. I think it's key to getting good results. If you guys check out my Instagram at Many Faces of Chicago, I got some pretty slick results on there, I think. So check it out. Let's go into the video now, please. Hey man, whoa, I'm glad I found you. And something I'm concerned about. I'm always here, what's up? I'm worried people aren't gonna get buccal fat anymore. Come on, man. People are always gonna get buccal fat. Listen, man, I'm telling you, all they need to do is work out. They can work out. No, they can have a good makeup artist. There's these new makeup artists out there. They're slick, dude. They're making everybody look good. Everybody's looking. There are good makeup artists out there. Buccal fat's different though, brother. Trust me. It's like comparing apples and oranges, man. You would be surprised. I'm going to show you. I know this woman, man. Whoo, what she can do with makeup. Plus, these kids are working out like animals these days. They're going to get all... Yeah, that's a good point. Themselves. Yeah, they are going to. But, mira, look at this. The thing about buccal fat is, you got to sculpt it. You got to hit it in the right... You got to hit it in the right spots. You know, you got to get the chisel look. When you get here, you boom. Then you get here. You get like the makeup artists do. You know what I'm saying? Oh damn! Ooh, volume in the right places. Peaks. Yeah, valleys, shadows and curves. Yeah, peaks and valleys, shadows and curves. Yeah. I like it. Oh. So I got Mr. Snatch here, my handy partner. Helps me kind of get things so that I can show patients exactly what I'm trying to do. We had a makeup artist that was going to join, but it sounds like she bailed. What? We're going to check the chats here. She was going to join, and apparently not. So anyways, you got me on there, Dane? Good. Yeah, perfect. So the buccal fat pad, what it is, right in here, that's where we're able to get that shadow. If you notice, the artists, they create a little bit of the appearance of a prominence here and a shadow down low. And that's exactly what the buccal fat pad sculpting can do. So the key is what I've added myself, and this is going to be published in Facial Plastic Surgery and Aesthetic Medicine this month, a surgical pearl video, so stay tuned, of how I do it. I do this, I sculpt the buccal fat pad, the actual fat pocket. I tighten the cheek mucosa, so I remove a portion of the cheek mucosa and suture that together in a running fashion. I take a strip of the buccinator muscle. That's the muscle inside your cheek that you can bite on. Helps you chew, so I tighten that. And then I augment the bone of both the maxilla and the mandible to really taper in those areas. So those are some key things that I do. And that's the kind of the Chicago that I try to get people to commit to. You don't have to do them all, but if you really want that contour, that's what you do. That's what I do. That's what you do. That's what we do together. So, the key is hot is hot. And this is something that's attractive. It's hot. If we can pull up that other video right now, I'm going to talk you through how I do it. It's pretty quick. It's just to give you, it might be a little too technical for some of the people on, but it's all done under local anesthesia in the office with some lidocaine. You can get started, please, Tara, under with lidocaine, a little chill pill by the mouth. And you just relax. About 1 week of a recovery, maybe a little bit less for certain patients, but I think it's making people happy. The video should start shortly. I'm going to get minimized. And then once I'm small, the video will get big. Do they see your desktop, Dame, while we're doing this? All right, good. So we'll get the video small. I think it's playing in the background there. All right, good. So there's the video. There's me. I'm marking out this line of perikeratosis. First, you sterilize it, or after you mark it out, you sterilize it first before you cut. Tiffany's videoing us there. That's actually Tara there. Okay, so this is key. I take an entire wedge of this mucosa, varies by the patient. Can range from 1 to 6 centimeters really in diameter. Now I'm removing the mucosa. The buccinator muscles next. We didn't include too much of the surgery to not scare people away, because the goal of this is to get people to come in and see us. So there's the mucosal wedge, looks like a worm. This is a good image of the buccinator muscle. I take a strip a little bit bigger than that classically. There's the strip coming. This part can bleed a little bit if you don't have the proper equipment. There's a little compilation of buccal fat pads coming out now. You can see the fat pad coming into the mouth. Then I use cautery or a couple other techniques to tighten and sculpt that fat pad. Different patient, other side. Everybody has a different, look at this one. Look how juicy that is. Really hydrated patient. So this is the fat pad coming out in a different patient, another patient. I'm sculpting it there. This patient didn't want too much sculpted, so we'll leave some in the body, or too much removed, so we leave some in the body and we continue to tighten it. At the end, we have a few patients, post-op results coming in. This is the real, and I put these long-lasting sutures in there, which I do come out. Good, so can you pause there? Good, so this is a great patient. This is a patient I wanted to review with makeup artists, because I think it would be pretty cool to see how they do it and how I do it. I think I'm better, but I should have showed up. Anyways, you can see, it's hard for me to draw on the screen, but the post-op is when she's wearing the black shirt. The pre-op is in the lighter color shirt there. And yep, she's using the mouse to kind of show that contour in there. Lack of contour, bingo, contour. So, and this is early. This is, I think, 1 month post-op. So, this is going to continue to suck. And it's interesting how it defines the jawline when you do this procedure. When you tighten that mucosa, I don't know if you guys can see me, but when I bite on my cheeks, that allows for some definition along the jawline, which can really be pretty cool. So often, and not uncommonly, do I include neck lipo or some face tight of the jawline at the same time for people who really want that kind of snatched look. So yeah, I think continue the video there for a sec. A couple more post-ops. Pause it when she comes in. Boom. So again, early results, but I did neck lipo on her. I can't lie. Neck and jawline lipo at the same time, which is a great combo. But she just looks, I mean, this is 1 month post-op. So look, she just looks like a new person, to be honest. It's crazy. And her results are continuing to come in. I was at a different practice before, so a lot of my long-term post-ops I don't have access to. So continue. You can play the video. Good, stop there. Great, so another one, and you actually can go a little bit further. Stop there. The key is to show this kind of sharpness of the angle, you go from this round kind of bubbly look to this chiseled kind of more significant, I don't know how to describe it, but it's just a more defined look, and that's what people are after these days. Okay, go ahead, continue. I think this might be it. Boom, stop there. I mean, give me a break. For God's sakes, look at that. Look at her jawline. Look where the buccal fat pad gets sucked in. The cervical mental angle turned into even to a negative angle. She was already had a pretty nice angle, but everybody wants what they don't have, so or what it wants more of what they have. So, and look at the angle of the jaw. Go back there, Tara, with the mouse. Yeah, lose that. Look, where is that? I don't know. Can't find it. Boom, it's there. It's perfect. I mean, that's freaking spectacular. So if this girl wants more, so actually we're going to do threads on her jawline next week. This one's a farther out result. This is a 4 or 5 month out result. Go ahead, continue. Okay, stop there. Look, you just got to look at this photo from afar. Don't look anywhere specifically, just look at it. She just got a little more definition, just a little more defined. I mean, it looks like you'd have a teenager there and then somebody in their 20s or 30s. It's the same patient, 4 months out. I think that might, no, keep going. Looks like there's a couple more. I think we're just talking a little bit here. It's okay. Chicago, you see that, how we gave the Chicago colors there. There we go, good. That's about right. Great, now she's gonna roll in again. Stop there. Look at the jawline again. I mean, this is buccal fat. I didn't do anything to the jawline, but it sucks it in because I took the mucosa, I took the muscle, and I tightened the bones. Tighten the bones? I did something to the bones. Bam! Look at that. Look at that jawline. Stop there. So I did neck lipo on her also, so I'm not lying. But it looks like she had a chin implant. I mean, just this woman actually told me, oh my God, I used to never put my hair back. It was always draping in front of my face. And now, bam, look at that. I mean, it's spectacular. It looks fake. Keep going. I think that's the last one. Chicago, the hands behind many faces of Chicago. So I think we're pretty much done there. I'm going to take some questions if you guys have the ability to do that on here. Last time I forgot to do that. We got called back for an encore. So happy to answer any questions. Topo Chico with a little tequila for the record. You got any questions?
Just one.
Okay, let's see. Let's see.
How long does this take?
What does this web? The surgery take, well, depending on what's added, it can take anywhere from 15 minutes to an hour. You're here, you end up being here for a good hour and a half, including the whole process. But if neck lipo's added, it can add another hour. Any more questions? We had another question on there. When does this?
How can I
think I'm getting taunted.
How can I expect my buccal fat removal surgery to look over
I like this question. This is, Dr. Yona. This is a smart person. That's why. It evolves over time. So the buccal fat pad is deep in the face. If you guys go to my YouTube, Many Faces of Chicago, surprise, I do a thing with a avocado, un avocate, where I show the buccal fat pad's like taking the bone of the avocado out, where the superficial fat, the fat that makes us look good, is like the meat of the avocado. So I leave the meat, I leave the good stuff. When the 60-year-old women come in here and want her face looking better, I put the fat externally from the, you go through the dermis to get to that superficial fat pad. We put it in there and make it look good. Buccal fat pad, take it from inside the mouth. So this is the key. It's, the buccal fat pad is this deep. It allows for a contour. The superficial fat pad makes the face look crinkly, makes it look bad if you remove those. So facial lipo I rarely do unless somebody had some sort of bad fat transfer, somewhere else, of course, not me, that they want tightened. So over time, it continues to get better. And we still recommend, superficial treatments on the skin, fillers, Botox, threads, those kind of things can affect those. But the buccal fat pad just continues to allow kind of that contoured look. And you have to like that. Some people don't like that look. I have patients come in and they want this filled right here. They're like, I don't like this shadow I have here. Boom, I'll fill it. That's different. You don't want buccal fat. But if you like that look, it's a long-lasting look.
Can you explain what you do with the mucosa and all else besides the fat removal?
Yeah. So, I don't do it in everybody. It's got to be the right patients, and it's in a pre-op discussion. But the mucosa, I actually tighten. I remove a portion of it, and then I suture the remaining portions together. So that's how I tighten that. I have tried a couple superficial tightening techniques, such as radio frequency and lasers, which I'm still playing with. But right now, removing it has been the best method for me. The buccinator muscle, it's a fan-like muscle. There's 4 bellies, Topo Chico has a lot of carbonation. 4 bellies of the buccinator muscle. Where the 4 come together is where I remove about a 1 centimeter strip. Then I suture that together as well at the end. When I say 4 layers, the reason I say that is because the bone, which is calcium hydroxyapatite, I often add a filler. And now I'm including, actually everybody in this webinar gets a free filler if they book buccal fat. So that's what I'll utilize to tighten that 3rd layer, the bone. Either here or here, depending on the patient.
Does buccal fat return ever?
No, it does not return. It's one of those deep fat. If you go to PubMed, for instance, and you Google and you type in buccal fat pad, go to PubMed, which is a reputable source to get good information. Type in buccal fat pad, stem cell, buccal fat pad, longevity, buccal fat pad, isolation. This is an isolated fat pad that should not return or gain or decrease over time. It's this persistent kind of globular fat pad. That's why I made that funny video in the beginning of people trying to work out, these skinny people, you know, with round cheeks. And it's just, that's what I have to say about that.
What are some of the complications and how are they handled?
Good question. The other day I drained an abscess in a patient, not my patient. Or I didn't have to drain it, but I saw a patient with an abscess. You know, these can obviously become infected. That's why I'm hyper sterile. I have a procedure protocol I have people go through. It starts 5 days prior to the procedure. You could hit the facial nerve. That's the nerve that controls your movement in your mouth. You could hit the nerve that controls the tongue if you get a deep enough abscess, or it gives sensation to the tongue. You could hit the parotid duct. The parotid is the gland right on the side of your face that allows you to salivate, or one of the glands that allows you to salivate. If you hit that duct, you could get a sialocele, which is a big conglomerate of fluid in the face. You could hit the facial artery and die. It'd be rare, but you could. I've gotten in the facial artery before. I just pinch it off and tie it. You know, I'm a surgeon, so you want a surgeon to be doing this. Asymmetry could happen. After that, it's about it.
What is the recovery like after buccal fat removal?
It varies by patient, but I tell people to plan, like to tell patients, to tell their family and friends that they don't want to know, that they're going to look like they had a dental procedure for about 3 to 5 days.
Is there an age limit for buccal fat?
An age limit? No, it does seem to be something we do in the young. Dr. Jonas really asking a lot of questions. It does seem to seem something we do in the younger patient population, but I've done it in almost every age group.
What if I don't like my results?
Then go somewhere else. Everybody likes the results I do. Stupid question.
Awesome.
They say there's no stupid questions, but there is.
That's all we have.
All right. Hot is hot. Signing out.